Hello, everyone. This is Laura Dearda with Becker's Healthcare, and I'm excited to bring to you today in our Health IT and Digital Health Spotlight Dr. Peter Chang, who is the Senior Vice President and Chief Transformation Officer at Tampa General Hospital. Dr. Chang, it's a pleasure to have you today.
Laura, so happy to be here.
Now, I'm looking forward to our discussion because I know Tampa General is such a unique organization and also very innovative, a lot of technology, but also interesting things that you're doing with care delivery models. And so I'm sure there are several areas that we'll be able to dig into. But before we do, just briefly, can you tell us a little bit more about yourself, your background in Tampa General?
Sure. I've been at TGH in one capacity or another for about 20 years. So I started here in 2004 as a third-year medical student and did all my training here at the University of South Florida. And of course, one of the primary clinical training sites was Tampa General Hospital. When I finished my training in internal medicine, I sort of thought about what was next in my career. I was moving on the academic side as one of the residency program directors and was really looking to see what else was out there and sort of tripped and fell into the chief medical informatics officer position. Did that for a handful of years, stood up Epic, one of the largest Connect programs from a hospital to the ambulatory clinic in 2015. And it somehow kept getting me pulled into operations. I was trying to do the IT work, was very happy with it, but saw a potential impact that I could have on the quality side of the equation, along with operations and throughput. And so that kind of pulled me into the idea of creating this clinical command center that we initially named CareCom. We built that with GE Healthcare over the last 6 years. And it was a great experience. And the outcomes were amazing from a quality and a throughput perspective. And then sort of sat back in my office one day and said, all we really did was sort of make this inefficient system a lot more efficient, but we didn't really redesign the system. And that kind of led me on the mission to start and implement the hospital at home program here at Tampa General. And that's been my focus for about the last 3 years, along with ambulatory access and care coordination, which are big ones, but kind of saw, well, by the time patients end up in the hospital, we've sort of missed the bus from an ambulatory perspective, right? Well, that could have been 30 years ago, or it could have been 3 days ago. And so, really finding a way to provide that access and diversifying the locations of care that we could deliver, i.e., the home, which is really why hospital home is amazing.
That's awesome to hear. And I can imagine so many folks across the country are really in a similar position of seeing changes within the care delivery process. Obviously, technology is making a difference and making new things possible. And so, figuring out how you can redesign and develop a strong health system as a result, just seems like incredibly meaningful work. I'm curious from your perspective, could you tell us about the most successful project or initiative from the last year? What did you do and what were the results?
So some of the things we've done, and it was sort of building off of the initial concept of our clinical command center or CareCom, we've sort of revamped it and renamed it. It's now the Care Coordination Center. And previously, while we had focused exclusively on the inpatient operations, as we look at care coordination, we're looking at the entire system. When I first started as an administrator here, our total revenue was slightly below 1 billion a year, and now I think we're slightly over 4 billion a year. So in the matter of 7 or 8 years, our revenue has increased fourfold. And so with that comes a lot more growth and the need for what we're calling the operating system for care coordination, which is really powered by Palantir. And so I'd say the most important project we've done in the last year has really been integrating Palantir across the entire ecosystem for advanced analytics and AI.
That's really cool to hear about, and definitely having those advanced analytics capabilities, I can imagine makes really a big difference in how you're able to operate and communicate and get into, more and more of the patient work that you want to be doing. So I'm curious, when you looked at how the community center was evolving and truly what difference it makes today, could you tell me a little bit about some of the things you're able to do now that you weren't able to do 5 years ago, for example, because you've gotten this system in place?
Yeah, and so, it was interesting because at the onset of the thought of a clinical command center, we have Epic as our medical record system, super happy with what it does for our patients and our team. But in regards to a command center view, it didn't really have the technology that it actually has today. So as we've sort of reimagined the command center into the care coordination center, we're using a combination of Epic and Palantir for things that we figure out are really going to be difficult to engineer in Epic. We've kind of done these advanced analytics, and it's caused us to be able to, instead of look at individual things that happen all at once, so we're getting just a ton of signal, of pings of all these different things coming in, we've been able to organize it and then prioritize it. And I'll give you one kind of concrete example. We implemented a system called Hospital Sync with imaging and MRIs. And by doing something very simple, looking at if a patient has a history of claustrophobia, that's not easily found in Epic. So we used a large language model to pull that information out of Epic. Have they received pre-medication to calm down their anxiety prior to an MRI before? And now we have an MRI that's ordered, we should know that this patient's going to have trouble if they go down to the MRI. And for the bedside nurse, they're not necessarily thinking about this. They're not thinking about the prior history that the patient's had. They're trying to get the patient down to their test. And so our MRI techs here in the command center can sort of view that information along with the MRI checklist. As silly as it sounds, no patient's going to an MRI until you've proven that they don't have a foreign object or another medical device that's going to cause them to have trouble in an MRI machine for everyone. And so even doing those simple things like a checklist, sometimes we're missing an element, we don't know which one, and the tech has to crawl into the medical record to try to find what's missing. But we're able to prioritize and automate. And what it's caused is a 30% reduction in routine MRI turnaround time. So not stats. We know stats, they need to happen right away. But for our routine exams are the ones that can end up waiting probably a little bit longer than we would like here in the hospital. And so we've had some really outstanding results of just being able to pull that data out of Epic, put our own insights to it inside of Palantir, and drive an outcome.
That's amazing here. Thank you for expanding upon that a little bit. Now, I'm curious, in the next 12 months or so, how are you going to build on this success, and what do you expect from your role as well as your teams? How will they change and develop as time goes on?
So actually, as the roles continue to change, I think the most important thing we can do as an organization is actually our culture and our change management initiatives. A lot of the technology that we're rolling out, we're trying to get the message out to our team that these automated and advanced analytics and artificial intelligence tools that we have, they aren't meant to replace people. We are a big believer in our people and our ability to diversify our skill set. And we're not looking at this as a way to replace the existing workforce that we have. We are looking at it as, can we make our workforce more efficient? So as we grow, we don't need to hire additional FTEs, which we know the labor crunch inside of healthcare and what it looks like. And so, trying to translate that message to a team member at the front line, we're really cognizant about that to make sure that they know how important they are to this organization and how their knowledge actually drives the development of a lot of these tools. When we create a workflow or a tool, we actually embed with the frontline team and figure out what their workflows are and where the pain points are and how we can help automate a lot of that information. So it's really exciting. I think that message of change, of kind of what's coming and knowing that we can be more efficient for our patients and our team, I think is the really exciting part as we start to look kind of what's coming in 6 and 12 months. I talked about an inpatient example of an MRI, but how does that translate to our TGH imaging centers in the ambulatory realm where they have the same problem, but maybe in a different way because it's an ambulatory patient? So really, really trying to spread these knowledge sets and skill sets and tools across the entire organization, everything from quality to finance to operations, is really kind of where we're headed in the next year.
That's helpful to know and understand. And certainly from that perspective of trying to incorporate the technology, but then change management, knowing so much of that comes down to the people, the culture, and the ability to understand how to rein in that technology and actually get it to do what you want it to do. What does that process look like for you? In especially thinking about that technology literacy, AI literacy, and more. How do you see that expanding in growing, whether it's on the clinical or administrative side?
Yeah, this is a really interesting question because my brain and my role sort of straddle operations and clinical. And so, if you were to approach any physician walking down the hallway, yeah, there's some really cool AI that's starting to infiltrate the space. Things like ambient listening for scribing technology, where they don't have to write their notes, it's sort of generated for them. So they're starting to get to it. But I think a lot of the frontline team that actually interacts with patients every day, they have some idea of what technology could provide for them, but they're missing the other 90%, and it's not to their fault. They're not technologists, they're clinicians. And so trying to impart the realm of possibility inside of their world, I think, is one of the biggest challenges we've had. So we say we want to engage with the front line, but the front line may not know technologically what's possible. So that marriage in between somebody that knows what's technically possible with somebody that knows the workflow, to put those two pieces together to develop a solution, is super important. And that's the gap we have to bridge. It's a really, really fascinating one. But the thing is, once you show the frontline team how things are done and what the capabilities could potentially be, then you kind of open the floodgates. So we're starting to like open and then it starts to come at you like a tsunami at all the requests that come in of the possibilities, which is really exciting. But from a prioritization perspective, that's kind of our next challenge, is figuring out, even after we deploy a tool, we may have, it's sort of like a snowball rolling down a hill. It starts off small, but as you deploy more tools and more people start to use it and more requests for enhancements come in, how do you prioritize and manage those things? Some of those things from a governance process is kind of where we're headed next in the foreseeable future.
Got it. That's helpful to think through, and it'll be really cool to embark on that continued process. Now, before we wrap up, I'm curious, what do you think will be possible in healthcare over the next 3 to 5 years because of technology that isn't possible today?
I would say better patient care, better coordination. And when we say better patient care, that's both for the patient and the healthcare provider. At the end of the day, I always ask everyone, even Laura, I'll ask you to think about your most memorable healthcare experience. And I would say 99% of people don't remember technology. They don't
Mhm.
remember how nice a building looked. They don't remember, they remember about the experience, if it was hard or easy, but they remember a person, right? They remember
Mhm.
the nurse that made a difference for them, or the doctor that took the time to explain a difficult situation, or the transporter that was just super happy singing a song with them as they were transporting them from one side of the hospital to the next. You'll encounter these things all over, and I think that's what makes healthcare a much different industry than other service oriented or even product development industries, is the people component of all of this. And so, I always center and focus around that, and how does that impact? So the question is now, how does that actually change outcomes for a patient? The dream one day is that, an ambulatory patient that gets a diagnosis actually has sort of an agenda. Right? They have, this is what's going to happen. This is the order in which it's going to happen. All of these things are already scheduled for you. And we've made it as easy as possible with locations closest to your home, and whatever we can take virtual, we have. It's funny story. Even within our own healthcare system, I was talking to one of my team members who had a knee replacement, and she emailed me the list of appointments that she had to go to prior to her knee appointment, and it was probably around 10, whether they be chest x-rays or joint x-rays or clearance by a particular physician. And we just have to find a way to use technology to make these things more automated and streamlined for our patients and of course our team.
I love that. It makes so much sense, and truly is galvanizing to think about how you can improve that patient experience and what it means to, have that memorable moment with every single touch that they have. Thank you so much, Dr. Chang, for your time today. I really, truly appreciate it and look forward to connecting with you again soon. And we'll also be excited to see you in Chicago for our Health IT, Digital Health, and Revenue Cycle event here coming up in October. I know we've got so much we're going to be talking about there, covering from technology to AI to patient experience and more. So really truly will just be awesome to see you there and continue on with this conversation.
Thanks so much.